All right, everybody. Hope you're doing well. Welcome to a Fix Your Gut live stream. I am your host, John Brisson. Today's stream is going to be on the medication Metformin, also known as Glucophage. Is it harmful for your digestion, and do I recommend it? First, this is our website, fixyourgut.com. We've been doing some remodeling of the website. If you click here, you can download the Optimal Health Blueprint and get our recommendations for supplements for both males and females and recommended brands to hopefully improve your health. We offer both coaching, both me and Jason Hooper do. You can pick up my book, Fix Your Gut. You can pick up liposomal glutathione from Frontline Performance, the old bulletproof glutathione formula, the liposome glutathione that works. You can pick it up. We also recommend Smidge as a probiotic. There's no D-lactane or histamine producing strains. There's a good probiotic. Down here we have recent posts that have been that me and Jason have both written. Jason wrote one on 5 reasons to lower your dose of vitamin C. I wrote about how chocolate can be harmful to your health. It's beneficial, don't get me wrong. Dark chocolate does have a lot of benefits for human health consumption. However, there are drawbacks of it too. And I also been writing a series about what is leaky gut and what causes it and what can be done for it. So yes, let's begin with Glucophage, Metformin. Is it harmful for your digestion, and do I recommend it? Glucophage, Metformin hydrochloride, is a much hyped medication even on alternative medicine. Metformin is a commonly prescribed medication for the treatment of type 2 diabetes. Metformin is also used off-label to increase longevity, supposedly, and to help achieve cancer remission. Though metformin is a better option than most prescribed medicine for the management of type 2 diabetes, and there have been many medications through the treatment of type 2 diabetes that have been recalled over the past few years due to issues that they may cause. I'm trying to think offhand of some that have been recalled, the names of them. Let me look up. I think Avandia was one. Yes. Avandia, which was used for type 2 diabetes, was recalled because of possible increase of cardiovascular and heart attack issues. So there have been a few more. Let me see. Type 2 diabetes medications that were FDA withdrawn. Reslin, back in 2000s, was another one. Avandia, like I mentioned, so you have Reslin, you have Avandia. You have, what's the drug that Shoemaker and Dave Asprey were discussing to reduce biotoxin illness that had links to bladder cancers? Here, diabetes drug links to bladder cancer. That would be the drug, would be Actos. Actos, which is the management of diabetes, also had elevated risks of causing bladder cancer. And I think it has a black box warning label, does it? Yes. Maybe. It's got a warning label, but doesn't have a black box warning label from the FDA. Yes, has black box warning label by the FDA too. So many of the diabetes drugs that are used for diabetes management have severe side effects. Some of them being, withdrawn off the market, ranging from bladder cancer to increased risk of cardiovascular disease. But metformin seems to be one that does have some benefits when used in the right circumstances compared to these other drugs. But we're going to discuss whether or not I recommend it. Metformin has a variety of side effects, some lesser known. So what are metformin's effects on gut health, and is it worth taking even if you have diabetes? What is glucophage metformin? Glucophage and metformin is a medication and classification by guanide used in the treatment of type 2 diabetes. Other medications in the biguanide family of drugs, fenformin and buformin, were withdrawn from many prescription markets around the world due to a severe side effect. Phenolating or using the butyl derivative of metformin increased lactic acidosis incidence, especially in people with compromised renal function, kidney function, leading to both drugs being banned before its use in the United States public. Standard metformin tablets contain povidone, magnesium stearate, hypermeliose, and polyethylene glycol. So people could be allergic to polyethylene glycol. A 1,000 milligram tablet only has the polyethylene glycol. As inactive ingredients, metformin extended-release tablets in the United States also contain cellulose, hypromeliose, and magnesium stearate as an active ingredient. So magnesium stearate is just stearic acid, which is a fatty acid bond to magnesium. It helps the pills go down the conveyor belt faster. And the oils could be rancid in the stearic acid, used to make the stearic acid, or stearic acid itself could be rancid. But I mean, compared to polyethylene glycol, which is known to cause allergic reactions, is one of the reasons why the COVID-19 vaccines are causing anaphylactic shock, because it's in the liposome sphere of the COVID-19 vaccines, some of them that we know of, like a Moderna or Pfizer's. So polyethylene glycol, and I guess I need to do a video on polyethylene glycol and update my polyethylene glycol blog. I don't recommend the use of Miralax for digestive issues because of the side effects associated with polyethylene glycol, like hypersensitivity, allergic reactions, to name a few. And it's only been FDA approved in adults for a week, the use of Miralax, and it has not been FDA approved for the use of children. The gastroenterologists just give it out like it's candy when someone's constipated. So what are the mechanisms of action for glucophage? Metformin is an anti-hyperglycemic agent, which improves glucose intolerance in patients with type 2 diabetes, lowering both basal and postprandial plasma glucose, so before and after a meal. Its pharmacologic mechanisms of action are different from other classes of oral anti-hyperglycemic agents. Metformin decreases hepatic glucose production, which is known as gluconeogenesis, decreases intestinal absorption of glucose, and improves insulin sensitivity by increasing peripheral glucose uptake and utilization. Liver, skeletal, muscle, endothelium, adipose tissue, and ovaries, which is why it is an off-label treatment for women suffering from polycystic ovary syndrome that have elevated glucose levels. Unlike sulfonylureas, metformin does not produce hyperglycemia in either patients with type 2 diabetes or normal subjects, and does not cause hyperinsulinemia. With metformin therapy, insulin secretion remains unchanged, while fasting insulin levels and day-long plasma insulin response may actually decrease. Multiple potential mechanisms of action for metformin have been proposed, including activation of AMP-activated protein kinase, known as AMPK, inhibition of complex 1 of the mitochondrial respiratory chain, more later on why this might be a serious side effect for some people in the blog, inhibition of mitochondrial glycerphosphate dehydrogenase, inhibition of glucon-induced elevation of cyclic adenosine monophosphate, CAMP, with reduced activation of protein kinase A, PKA, and the medications influence the diversity of your gut microbiome. Activation of AMPK is required for metformin's inhibitory effect on liver glucose production. AMPK is an enzyme that provides a vital role in insulin signaling, glucose and fat metabolism, and energy production. Finally, an increase in AMPK initiates the glucose uptake from the bloodstream and shunts it to the muscular system, where it can be used for energy. Metformin also increases the concentration of cytosolic adenosine monophosphate, AMP. Increased cellular AMP has been proposed to explain the inhibition of the glucon-induced increase in CAMP and the activation of PKA. Increasing cellular AMP would make metformin a glucagon, a peptide produced by the alpha cells in the pancreas to increase glucose and fatty acids in the bloodstream, which, when needed for energy metabolism, antagonist, which would lead to a lower blood glucose level. Finally, microbiome modulation from metformin ingestion might be why the medication improves insulin sensitivity and mitochondrial function. How does glucophage metformin usage affect your digestive health? Metformin has been shown to have both positive and negative effects on a person's digestive health. Metformin's most frequent side effects are gastrointestinal, include diarrhea, cramps, nausea, vomiting, abdominal pain, bloating, burping, and flatulence. However, many people also tolerate metformin very well. and studies have shown that it can improve your microbiome and relieve type 2 diabetes. So what are some of the positive effects that metformin may have on your digestive health? Metformin has been shown in vitro and human in vivo stool testing studies to increase colonies of probiotic bacteria, including bifidobacteria, Akkermansia mucophilia, Butyrivibrio, and Lactobacillus. Metformin use has been associated with higher short-chain fatty acid production by the intestinal microbiome, including butyrate, acetate, and propionate. An increase in short-chain fatty acid production by the intestinal bacteria can explain why taking metformin may cause weight loss and improve blood glucose regulation. Short-chain fatty acids have important metabolic functions and are crucial for intestinal health. In addition to the reported effects of short-chain fatty acids in gut health, short-chain fatty acids exhibited beneficial effects in peripheral tissues such as adipose tissue, skeletal muscles, and liver by controlling substrate metabolism and function, leading to improvement of insulin sensitivity. Recent work highlighted that intestinal dysbiosis is associated with altered short-chain fatty acid levels in humans. Significantly recent animal studies have demonstrated that butyrate and propionate activate intestinal gluconeogenesis, displaying beneficial effects on glucose signaling and energy homeostasis. Metformin has also been shown to reduce serum gram-negative bacteria-produced lipopolysaccharides, which are known as endotoxins. Endotoxins can enter the bloodstream in people with leaky gut and trigger systemic inflammation. Healthy gut will have appropriate amounts of gram-negative bacteria that produce endotoxins, which are either neutralized by the microbiome or immune system, or eliminated from our body and our stool and do not leak into our circulatory system. Metformin may help relieve leaky gut for some people by improving their microbiome by increasing colony-forming units of the above probiotics and increasing short-chain fatty acid production of butyrate, for example, which feeds the colonocytes, which colonocytes are epithelial cells in the colon, reduce inflammation, and improves gut junction barrier integrity. Finally, the increase of cellular AMPK production from metformin ingestion may lead to healthier intestinal cells that have adequate energy for proper functioning, which leads to a more robust gut barrier. Metformin also increases colony-forming units of Akkermansia mucophilia, a gram-negative bacteria that helps maintain our mucosal barrier. Akkermansia mucophilia helps maintain our mucosal barrier by ingesting our mucosa's weakened areas, which triggers our bodies to secrete mucus for repair. People suffering from acid reflux have shown in studies to have reduced Akkermansia mucophilia colonies in their esophagus, leading to a broken esophageal reflux barrier, triggering inflammation from reflux. However, too many colonies of Akkermansia mucophilia can lead to reflux and leaky gut as well, because they may ingest even healthy parts of the mucosal barrier when overgrown. Microbiome balance is essential. So if you take metformin and reflux or leaky gut develops or worsens, it might be because you develop Akkermansia mucophilia dysbiosis. Though metformin may benefit one's gut health, some people who take metformin can worsen health and our gut's health from taking the medication caused by multiple mechanisms. Metformin usage increases the bile acid pool within the intestine by reducing ileal reabsorption. Now, the ileum is the distal part at the end of the small intestine. Bile is reabsorbed towards the end of the ileum. Metformin seems to have a direct action on the ability of the enterocytes within the ileum of the small intestine to reabsorb bile. Small intestinal bile acid transports reside within the ileum's distal lining and allow bile to be absorbed into the portal vein and returned to the liver to be used again when needed. Since metformin is an AMPK activator, it can directly affect bile being reabsorbed within the digestive tract. Intestinal AMPK binds directly to the farcinoid X receptor within the ileum, which signals enterohepatic recirculation, reducing the amount of bile reabsorbed. Changes in the bile reabsorption increase glucagon-like peptide 1, GLP-1 secretion. GLP-1 promotes insulin secretion by the pancreas, inhibits glucagon release, reduces hepatic glucose production, increases satiety, which is reducing overeating because satiety is the feeling of being full, increases pancreatic B-cell glucose sensitivity and neogenesis, and activates adenylate cyclase that increases the production of CAMP from adenosine triphosphate or ATP. Metformin reducing bile acid reabsorption triggers the secretion of GLP-1, which relieves type 2 diabetes through multiple actions. Disrupting enterohepatic circulation of bile salts has potential consequences for cholesterol homeostasis, enteroendocrine function, and glucose homeostasis. Cholesterol homeostasis disruption can lead to a decrease in cholesterol levels, but remember, among other things, cholesterol is vital for the productions of sex and thyroid hormones. However, metformin's usage was associated with a decrease in serum thyroid-stimulating hormone, possibly by enhancing the effects of thyroid hormones in the pituitary and activating AMPK to improve thyroid function. Enterohepatic circulation disruption leads to increased bile salt concentration in the colon. Reducing colonic bacterial colonization may help people with colonic overgrowth, but for some people with a healthy colonic microbiome, it can reduce probiotic bacteria colonization. Because bile salts are antimicrobial, a reduction in bile acid absorption has been suggested as a mechanism through which chronic metformin usage may lower cholesterol levels. It has also been suggested that increased luminal bile salt concentration will have an osmotic effect, which can lead to diarrhea, a common side effect of metformin usage. Bile salt reabsorption issues can cause diarrhea, and if severe enough, have shown to, in studies, increase colonies of the opportunistic bacteria Escherichia and Shigella. The bacteria are persistent and adapt when necessary. They are bile resistant and can survive the increased fluid amount being flushed in the gastrointestinal tract, causing diarrhea. But both bacteria and proteobacteria, known to produce endotoxins that cause inflammation, both bacteria are proteobacteria, known to produce potent endotoxins that cause inflammation, cause or worsen leaky gut, and reduce probiotic bacteria colonies. Metformin supplementation and studies have shown that though it can increase colonies of probiotic bacteria, including bifidobacteria, it can also increase colonies of Escherichia and Shigella, where it causes bile reabsorption issues and diarrhea. A reduction or lack of simple carbohydrate ingestion, mono and disaccharides, may reduce Escherichia colonization because the bacteria rely on substrates provided by polysaccharide degrading anaerobes to survive. So if you have diabetes and are on metformin, it's probably better for you to significantly reduce your table sugar, fructose, and lactose consumption, especially if you're having gut issues while taking the medication. Metformin use is known to cause vitamin B12 deficiency, which occurs because the medication causes vitamin B12 malabsorption. Early theories of why vitamin B12 deficiency occur with metformin use included the drug modifying bile acid metabolism, changing the microbiome. Certain microbes can pirate vitamin B12 we ingest and use it for their survival. Other affecting intrinsic factor secretion. However, recent research has shown that metformin interferes with calcium-dependent membrane action responsible for vitamin B12 intrinsic factor absorption in the ileum. Vitamin B12 deficiency can cause or worsen neuropathy, which many people with diabetes are suffering from. So it's important to supplement when needed. If you're taking metformin, then I recommend that you get your vitamin B12. If low, you might be suffering from B12 deficiency. And homocysteine, if elevated, you might be suffering from B12 deficiency. Blood levels checked every few months. And if needed, get methylcobalamin B12 injections to improve your B12 storages. The shot should only contain methylcobalamin, salt, and water, no other additives. Does Fix Your Gut recommend the use of glucophage? If you have type 2 diabetes and nothing seems to be working to lower your blood glucose levels, then glucophage metformin, I believe, is one of the safest diabetic medications. I do believe that for most people who have type 2 diabetes, then proper diet, perfect health diet for some, cyclic ketogenic diet for others, frequent exercise, proper omega-3 fatty acid ingestion, proper sunlight exposure, adequate sleep hygiene, and magnesium supplementation for most people should relieve their type 2 diabetes. If you have to take metformin, then make sure you get your vitamin B12 tested, and supplemented when needed. Also, it is essential to reduce as much as possible your simple carbohydrate intake, as well as to prevent Escherichia dysbiosis from occurring. For such, metformin usage can affect your digestive health and microbiome positively. For others, not so much. Everyone is different. So, though I do think as far as diabetic medications are concerned, metformin is one of the better ones. A lot of the other ones, like we mentioned, even the previous derivatives of metformin or previous biguanide medications, they were withdrawn or weren't even they were withdrawn through other markets throughout the world, or they weren't even improved in the United States because they caused lactic acidosis, where metformin seems to not cause that much of increase of lactic acidosis incidence, if any. So, like, if someone has to take a medication for diabetes, metformin is the preferred medication. However, I do believe that most people shouldn't use it to enhance longevity. Proper circadian rhythm and sunlight exposure, and proper sleep and stress reduction, proper diet, proper supplementation of minerals and vitamins that are in your diet when needed. all of those things can enhance and improve one's longevity. Quitting smoking, quitting alcohol use, quitting chronic cannabis use, all of those things. If you're doing it for longevity, proper exercise, I named. There's probably more I can name if I sit here and thought about them, right? But you don't need to take glucophage for the supposed benefit. The studies are mixed of increasing one's longevity by enhancing mitochondrial function. Okay. And also for cancer treatments, maybe. I believe in integrative medicine. I'm not against pharmacology when used properly. Just like I'm not against the use of natural medicine when used properly either. There's a lot of charlatan, a lot of misinformation on both sides. If anybody tells you otherwise, they're mistaken. Natural medicine isn't going to save you in an acute accident, or something that's quite severe. It may supplement your recovery. For example, if you get in a car accident, natural medicine may help supplement your recovery. If you're rushed to the hospital from a car accident, you're bleeding out on the side of the road, but it won't save you right then and there. Conventional medicine can, when used properly in emergency situations. So there needs to be a balance. Conventional medicine has a horrific track record for chronic diseases, what are known as autoimmune conditions, cancer, and so on and so forth. So there needs to be a balance. There needs to be an integration between both forms of medicine. And so like I mentioned, most people with diabetes, if they just get their diet under control and they reduce their sugar consumption and they lose weight and they exercise more, they might need to take certain supplements like magnesium or they can take lipoic acid if they're not burdened with mercury. They don't have mercury amalgams in their mouth because lipoic acid can redistribute mercury, pull mercury out. If you are mercury burdened, I believe you look into the work of Dr. Andrew Hall Cutler. But there's certain supplements. Chromium's another. Chromium polynictinate. And of course, I am not a doctor. I'm not a healthcare professional. I'm just someone who researches this stuff for a living. Any advice that I give you, please run it, through your healthcare professional before following any advice I give you on this channel. All right, or any advice on my blogs. But that being said, it doesn't mean that I don't know what I'm talking about. Just because I don't have an MD next to my name. So there are many ways that a person can correct their type 2 diabetes. Diet, exercise, supplementation, proper circadian rhythm and sunlight exposure, reduction of blue light at night. There's many different things that could be put in place without you having to resort to medication in most cases. And if you have to resort to medication, then the medication that I would choose, if we're doing by less harm here, would be glucophage or metformin. There's ways that you can tweak the side effects associated with metformin, like the gut changes, and I mentioned it in the blog, the gut microbiome changes, or the bile acid diarrhea. Activated charcoal can help with that. Or the B12 deficiency, which metformin is known to do, but through many different mechanisms, one possibly including the inhibition of the intrinsic factor in your stomach, which kind of helps coat and protect the B12 so it can be later and so the B12 is not broken down by stomach acid and enzymes, so it can be absorbed in your small intestine later on. In conclusion, metformin is not a horrible drug. However, it's a drug that should be used when necessary. And there should be other things that should be tried first to get your type 2 diabetes under control before giving metformin, unless your blood glucose levels are extremely high. Let's say you're morbidly obese, your A1C is very high, 8 to 10 plus. then yeah, maybe the use of metformin might be necessary at that time, or insulin until you can lose the weight and get healthier and supplement. Like there is some caveats, all right. But the average person who goes in with that's dealing with pre-diabetic blood glucose levels or hemoglobin A1C levels, if you take some of the advice that I've given during the stream of how you may be able to correct that, you could correct that before it ever turns into type 2 diabetes. In most cases, it just takes a little bit of you taking responsibility for poor choices that you have made in your life, and working towards goals of being healthier, which isn't easy. Some people can overcorrect. Some people can go too far as well. You can swing in either direction, right? You can not really take care of your health at all, or you can overcorrect and not enjoy life. That's a problem. There needs to be a healthy balance somewhere in the middle. Like I myself do best to abstain from sugar consumption. However, if it's a special holiday, like a birthday of a loved one, or my birthday, or I'm on vacation, then yes, I might indulge in sugar consumption. If I go to Philadelphia and I go by the Happy Mixer, which is a gluten-free bakery, you darn right I'm going to eat some gluten-free donuts. All right, so that's it, again. That's within moderation. I'm not consuming Hershey's chocolate bars every day. I love the taste of them, but they're bad for me. They're bad for you too. They're full of a lot of high fructose corn syrup and a lot of bad products, right? Like Reese's peanut butter cups are good, but they're not good for you. But if I have one, around Easter, a handful, that's fine. If I eat them on a daily basis, that's a problem. So there needs to be a balance between not caring about one's health, but overcorrecting to the point where you never get to enjoy the food that you eat, the diet that you follow, your exercise regimen, whatever. It's about repetition. Once something becomes extraordinarily dogmatic, most people can't handle that. Their brains can't handle that. That's why most diets fail, because a person goes, okay, I was weak here, I cheated, it was a celebration for a coworker, and I ate some piece of cake, therefore I'm not going to diet anymore. When you're making healthy choices, it's about making those healthy choices as frequently as you can, and continuing with them over a long period of time. If you set up in your mindset to do it, you're going to be strict and you're not going to allow yourself, any leeway, most people will fail because of that. Not everyone. And there are some instances where you have to completely abstain. For example, if you're a chronic alcoholic, some people have to completely abstain from alcohol. I understand that. But in most cases, when people say, I need to lose weight, I need to lose 40 to 50 pounds, I'm going to go on a diet, and they radically change their diets, and then they don't stick with them, a lot of it is because of that. Kind of being dogmatic about one's diet and overcorrecting. You go from being completely unhealthy to trying to do everything right, and in doing so, most people fail. It's a problem. It's a major problem. So, if you're going to implement certain changes in your life to treat your type 2 diabetes, diet, exercise, proper circadian rhythm, supplementation, try to do those things more often. Try to be more mindful and self-reflect and realize, and also have a reason why you're doing these things. Are you correcting your type 2 diabetes because you want to live longer, you want to live healthier? Who and for what do you want to live longer and healthier for? Do you want to live long and healthier for family members, friends, yourself? Ultimately, it should be for yourself. But, some people need external reasons. I want to live longer and healthier because I want to see my child graduate from high school. So you work towards that. So I guess in conclusion, does Fix Your Gut recommend metformin? In some cases, yes. It's not the worst drug or medication that you could pick for treatment of your type 2 diabetes. However, there are drawbacks associated with the medication, a bit less than other medications that are used for diabetes, some which have been withdrawn from the market, some who have black box warning labels, lactose, like to increase the bladder cancer. So if you had to choose a medication, metformin is one of the better ones. And you can tackle a lot of the side effects with the metformin use just by, eating less sugar to feed E. coli in your microbiome, which you should be doing anyway if you're type 2 diabetic. Taking B12 supplementation if you have a B12 deficiency, maybe increasing stomach acid, like taking or decreasing stomach pH, like taking beta-NaCl, improve digestion if you're having some belching and some maldigestion. Maybe some activated charcoal off and on if you're having bile acid reabsorption issues to help absorb the bile acids. There's many different things that can be done. All right, everybody. Take care. See you soon.